Now I am going to present about osteoporosis. Osteoporosis is a disease review. Osteoporosis, a disease review and mechanism of aging. Osteoporosis is underdiagnosed and untreated. Untreated throughout Asia, particularly in rural areas due to low provision of technologies like dual X-ray absorptiometry, which are required to make diagnosis. Osteoporosis-related fractures can affect any bone, but no, can affect any. But common sites are forearm, that is colli fractures, and spine vertebral fractures, humerus, and hip. Hip fractures are most serious complication of osteoporosis and have immediate mortality of about 12%. And continued increase of mortality of about 20% when compared with age-matched controls. Treatment of hip fracture accounts for majority of health care costs associated with osteoporosis. Epidemiology. Osteoporosis is the most common bone disease. Osteoporosis is the most common bone disease. It has been estimated that more than 8.9 million, that is around 9 lakh fractures occur worldwide. And known most of these occur in patients with osteopenia and osteoporosis. About one-third of all the women and one-fifth of men aged 50 and above suffer fractures at some point in life. The burden of osteoporosis-related fractures is predicted to increase by 2 to 3-fold by 2050 on a worldwide basis due to aging of the population. Causes of osteoporosis. Osteoporosis is occurs due to endocrine disease like hypogonadism, hyperparathyroidism, hyperthyroidism, Cushing's syndrome. Causes osteoporosis occurs due to inflammatory disease like rheumatoid arthritis, ankylosing spondylitis, inflammatory bowel disease. Drugs. Drugs are glucocorticoids, aromatase inhibitors, gonadotropin-releasing hormone agonists, thiazolidinediones, anticonvulsants, levothyroxine over replacement, alcohol intake that are greater than 3 units per day, and also due to heparin. Osteoporosis occurs due to gastrointestinal diseases like malabsorption, chronic liver disease, lung disease, chronic obstructive pulmonary disease, cystic fibrosis. Miscellaneous causes of rheumatoid arthritis are myeloma, systemic mastocytosis, homocystinuria, occurs due to immobilization, anorexia nervosa, low body mass index, highly trained athletes, heavy smoking, and HIV infection. Clinical features. Osteoporosis does not cause any symptoms unless a fracture occur. Non-vertebral fractures are almost always caused by traumatic event, mostly due to a simple fall. Fragility fractures are the most common clinical features of osteoporosis-induced fractures. These fragility fractures occur due to fall from a height or less. Fragile fractures are typical of osteoporosis. It is important to remember that majority of people who suffer a fragility fracture do not have osteoporosis, but most of them have normal BMD and most of them have osteopenia. Pathophysiology. The pathophysiology. The defining feature of osteoporosis is reduced bone density, which causes microarchitectural deterioration of bone tissue and leads to increased risk of fracture. In response to minor trauma, the risk of fracture increases markedly with age in both genders. This is mostly attributable to the increased risk of falling with age, but is also due in part to age-related decline in bone density, especially in women. Bone mass increases during growth and reaches peak between the ages of 20 and 45, but falls thereafter in both the genders with accelerated phase of bone loss after the menopause in women due to estrogen deficiency. The reduction in bone pathophysiology mechanism of aging. The loss of bone with aging is caused by imbalance in bone remodeling cycle, where the amount of new bone formed by osteoblasts cannot pace with the amount of bone that is removed by osteoclasts. It is more of the bone is lost to osteoclasts than formed through osteoblasts. This reduction in bone mass is due to reduction in conversion of bone marrow cells, bone marrow stem cells to adipocytes as opposed to osteoblasts. Osteoporosis sometimes occur because of failure to attain adequate levels of peak bone mass, but is more commonly to age-related bone loss. Osteoporosis is a complex disease and occur in association with a wide variety of risk factors. Genetic factors account for about 8% or 80% of variation in bone density and genome-wide association. And studies have shown that susceptibility is determined in part by a large number of common variants, some of which involved in the rank and WNT signaling pathways. Lately, osteoporosis may be caused by mutations in single genes. Environmental factors such as exercise and calcium intake during growth and adolescence are important in maximizing peak bone mass and regulating rates of postmenopausal bone loss. Smoking has a determined effect in BMD. Those who smoke have increased risk of bone fracture. And this is also because female smokers have earlier menopause than non-smokers. Higher alcohol intake is recognized cause of osteoporosis and fractures. Heavy alcohol intake is recognized cause of osteoporosis and fractures. but moderate intake does not substantially alter risk. The term idiopathic osteoporosis is frequently used to describe the occurrence of osteoporosis in patients with no specific underlying cause. Idiopathic osteoporosis is occurs due to unknown factors. Osteoporosis occurring due to unknown factors. It's slightly misleading since most, if not all, patients in this category have age-related osteoporosis or osteoporosis associated with inheritance of genetic variants that regulate bone density. Idiopathic osteoporosis. Age-related osteoporosis also comes under idiopathic osteoporosis because the cause of age-related bone mass is not known. Secondary osteoporosis. Secondary osteoporosis can occur in association with a wide variety of diseases and drug treatments. And in many cases, more than one disease or risk factor is operative. The most important causes are summarized. Secondary causes of osteoporosis are particularly common in men, occurring in up to 50% of patients. Hypogonadism, glucocorticoid use, and alcohol excess are the most important predisposing factors of osteoporosis. Glucocorticoid induced osteoporosis is common problem in patients with systemic inflammatory and chronic pulmonary disease. Patients, the risk of osteoporosis is related to dose and duration of glucocorticoid therapy and increases substantially in patients who have more than 7.5 mg of prednisolone daily for more than 3 months. Osteoporosis risk is more in people with inflammatory diseases because in these inflammatory diseases, glucocorticoids are used as a treatment option. If these glucocorticoids are used, they cause bone deterioration. Systemic glucocorticoid causes more bone deterioration than inhaled glucocorticoids. Glucocorticoid induces osteoporosis. Glucocorticoid mainly causes osteoporosis by inhibiting bone formation, causing apoptosis or cell death of osteoblasts and osteocytes. Other contributory factors for glucocorticoids is inhibition of intestinal calcium absorption, increased renal excretion of calcium, and secondary hyperparathyroidism, which stimulates osteoclastic bone resorption. Pregnancy-associated osteoporosis. This is a rare form of osteoporosis which typically presents with back pain. Dual X-ray absorptiometry and BMD. Normal is BMD is greater than -1, it is normal. If bone mineral density is between -1 to -2.5, it is osteopenia. bone mineral density, the values are less than minus 0.5 or equal to minus 2.5. It is osteoporosis. Thank you.